Okay, this is Dr. Azi, and this is the 11th part or session in polytrauma station pathology in MRCS Part B. In this session, it will be short and there will be some questions that will be asked. After asking about bone healing stages, there will be some miscellaneous questions, okay? So let's go. The first question that will be asked here is that uh, what are the effects of prolonged immobility on bone? Okay. What are the effects of immobility on bone? Prolonged immobility. And this is a common question. Most of you know the answer, and there will be no problem about that. And as you know, number one, there will be loss of bone density. Okay. The density of the bone will be reduced. Okay. And the second thing that will happen is that there will be an increased risk of osteoporosis. Okay, so there is an increased risk of osteoporosis. These are the two consequences of prolonged immobility on the bone: loss of bone density and increased risk of osteoporosis. Okay, then the examiner will ask you another question, and he will ask you about the effect of the fracture. Okay, the effect of the fracture on effect of fracture on calcium level, general calcium level. Okay, and you want to know that there is no effect. Okay, there is no effect on the calcium level in the body due to the fracture. Okay, no effect. This is the second or the next question, and next to that, he may ask you a question that he may ask directly now, or he may surprise you by that question at the end. Wherever he will ask you the question, we will tell you about the question now. And he will tell you that this patient, that patient in the scenario before, that patient had a fracture, and it's a long bone fracture. And this patient had something called ORIF. This is open reduction internal fixation. You know that already. Okay, so this patient had this operation, open reduction internal fixation, and now patient discharged. Okay, which organism do you expect to infect this patient? Okay, and in this case here in open reduction internal fixation, you should expect most of the wounds, and the most common organism in wound infections is Staphylococcus aureus. But here in open reduction internal fixation, you want to expect Staphylococcus epidermidis. Okay, fine. Epidermidis. I don't know if I'm writing it right or not, but it is Staphylococcus epidermidis. Epidermidis. Sorry. Okay. Anyway, so this is the organism that you are going to tell. These are some little piece of microbiology. Okay. So I will see you in the next session.